Have you ever heard of a disease so rare that it affects only a handful of people worldwide? What if your own immune system turned against you? Imagine a condition that mainly affects the brain, eyes, and inner ear. This is the mystery of Susac syndrome. It occurs when the immune system attacks tiny blood vessels in the brain, retina, and inner ear. These vessels become inflamed and can get blocked. Susac syndrome primarily affects young adults. Its symptoms often mimic other conditions, making diagnosis challenging. With proper diagnosis and treatment, many can experience remission and live full lives. Diagnosing Susac syndrome is like piecing together a complex puzzle. Doctors rely on a combination of tools and techniques to identify this elusive condition. One crucial step is a thorough medical history and physical examination. Doctors will ask detailed questions about the patient's symptoms, their onset, and any relevant medical history. A neurological examination will assess the patient's vision, hearing, balance, coordination, and mental state. Imaging studies such as MRI, magnetic resonance imaging, scans of the brain are crucial in detecting characteristic lesions or abnormalities. Doctors may also perform a spinal tap or lumbar puncture to analyze the cerebrospinal fluid, the fluid that surrounds the brain and spinal cord. This can reveal signs of inflammation or specific antibodies associated with Susac syndrome. In some cases, a biopsy of affected tissues may be necessary to confirm the diagnosis. Susac syndrome often manifests in a triad of symptoms, affecting the brain, eyes, and inner ear. However, not everyone experiences all three, and the severity can vary greatly. One of the most common symptoms is encephalopathy, which affects brain function. Patients may experience headaches, confusion, memory problems, personality changes, and even seizures. Visual disturbances are another hallmark of the disease. These can range from blurred vision and floaters to partial or complete vision loss. Inner ear involvement can cause hearing loss, tinnitus, or ringing in the ears, and vertigo, a spinning sensation. Other less common symptoms include weakness, clumsiness, and speech difficulties. It's important to remember that these symptoms can fluctuate over time, with periods of flare-ups and remissions. Section 4. Rarity in the ranks. Understanding the numbers. Susac syndrome is incredibly rare, making it a challenge to study and understand fully. It is estimated to affect fewer than 1 in a million people worldwide. Due to its rarity, precise figures on incidence and prevalence are difficult to obtain. However, studies suggest that it may be slightly more common in women than in men, with a female-to-male ratio of approximately 3:2. This means that for every 3 women diagnosed with Susac syndrome, 2 men are diagnosed. While the exact cause of Susac syndrome remains unknown, researchers believe that it is an autoimmune disorder, meaning that the body's own immune system mistakenly attacks healthy tissues. The triggers for this immune system malfunction are still being investigated. Section 5. Hope on the horizon. Prognosis and outlook. While Susac syndrome can be daunting, there is hope. Early diagnosis and treatment are crucial. Treatment involves immunosuppressive therapy, corticosteroids like prednisone reduce inflammation. Other medications may maintain remission. The course is variable, with some having single episodes, others relapses. With treatment and monitoring, many improve and lead fulfilling lives. Continued research offers hope for more effective treatments.